Since the outbreak, doctors have been fielding countless questions, as you can imagine, from concerned people asking, what are the differences between COVID-19 and the flu? So to sort out the confusion, we sent ABC4's Brittany Johnson to get some answers. She joins us live now. And Brittany, what did you find out?
Well, Nick, we do know now that the COVID-19 and the flu carry some similar symptoms, things like cough, fever, and shortness of breath. Now, to help protect against both, doctors are urging people to practice good respiratory hygiene. That means when you cough or sneeze, do it in your elbow. And when you wash your hands, do it for at least 20 seconds. Use soap and hot water.
How does COVID-19 compare with the flu? It's the question dominating many news headlines and social media timelines. Well, when it comes to the flu, at least 20,000 Americans have died from the respiratory illness this season, according to the Centers for Disease Control and Prevention.
Now, that doesn't mean that COVID-19 is not more deadly or less deadly. COVID-19 certainly has the potential to kill the same number or greater number than the flu.
Dr. Daniel Leung is with University of Utah Hospital. He says the concern regarding COVID-19 is that the virus is new and comes with a lot of unknowns about how it's transmitted and how many people it can infect.
Another difference is that we have a vaccine for influenza, as we don't have a vaccine for COVID-19. We also have medication that can treat influenza, so oseltamivir, but we have no proven treatments for COVID-19. It also has potential to overwhelm our healthcare system, which in the setting of influenza, which is seasonal, we usually can have a rough estimate or a good guess at how many people are going to come to our hospital and be hospitalized.
An associate professor in the Division of Infectious Disease, Dr. Leung, says telling the difference between flu and COVID-19 symptoms can be difficult.
Both cause cough, fever, both can cause you shortness of breath. One difference that we've seen is that little kids and children in general are less likely to be very sick from COVID-19, whereas little kids can get very sick from the flu. COVID-19 and the flu both impact the elderly.
The doctor is also encouraging everyone tonight to go out and get your flu shot if you haven't done so already. Nick, back to you.